Welcome to Lifestyle Matters. I'm Marilyn Moore. We have Dr. Dalal with us today. He is a joint replacement surgeon at Fresno Surgical Hospital. Doctor, thank you for joining us.
Thank you for having me.
Let's talk about joint replacement surgery. What exact surgeries do you do?
So a joint replacement surgeon mainly does surgery for arthritis or degenerative conditions of the joints. This leads to pain and disability in people and prevents them from walking and doing the things that they enjoy. So a joint replacement surgeon will replace these arthritic hips and knees mainly with metal and plastic implants.
And what is the outcome of doing a surgery like this, if you've struggled with arthritis for a good majority of your life?
Joint replacements are among the most successful surgeries ever invented. So people frequently report 90% satisfaction with their artificial hips and knees, and they're very durable. Anyone's best guess these days is that a joint replacement may last anywhere from 15 to 20 years, which has been a major advancement in technology.
So are you dealing with people that are a little bit older in life, or is it a younger generation?
So the classic joint replacement patient used to be someone that was a little older, maybe even retired, and that's because we would always tell patients to wait because we were unsure about how long the joints would last. Nowadays, though, the biggest growth in joint replacements tends to be in younger people who don't want to live with disability and want to get back to doing the things that they enjoy.
So you're saying younger people are developing arthritis and different pains throughout their hips and their knees. Is it because of sports?
I think young people have always had arthritis to some extent. They just have doctors that are more willing to try to treat that earlier for them. And certainly an active lifestyle, prior knee surgeries, ligament injuries, meniscus tears, all these things do contribute to getting arthritis down the line.
I agree. I think I have arthritis in my thumb because I text too much, which is just terrible. So I wish you were a thumb surgeon.
I think we'll find out about that in 20 years or so if it really does make a difference.
Let's talk about the customization of orthopedics. Tell me more about that.
So with the ability to take digital imaging, transmit large digital files, and the computer ability to create 3D reconstructions, there is now the ability to create a fully custom joint replacement. That means a joint replacement that fits a patient more precisely than we had the ability to do that before. And this has been a development probably in the last 6 or 7 years and is now widely available and is now available at Fresno Surgical Hospital. So a patient can have a CAT scan of their knee, and this CAT scan can then be used to create a fully custom joint replacement for that patient. And it's just a more streamlined and potentially a more satisfactory result.
I was going to say, so are you seeing a better outcome from this, type of development?
In the past, I have. I've noticed that my patients with their custom joints were very, very happy and seem to recover faster, which is really what people want. They want less pain. They want quicker recoveries. They want the surgery to interfere with their life as little as possible.
Tell me more about the recovery of getting, a hip or a knee worked on.
Hip and knee recovery has been a major advancement as well. We've gotten better at managing people's pain, anticipating what's going to hurt, and modifying the surgical technique. Whereas people used to spend 2, 3, 4 days in a hospital after surgery, people routinely spend 1, maybe 2 days and are back to doing most things at around a month.
Gosh, that is amazing. I think that when you're out with a hip, you're gone for months. I think as you get older, the recovery time obviously is it's a harsher.
Believe it or not, people recover quickly from hips, more quickly than knees, in fact. And hip replacement patients are among the happiest.
Well, that's great to hear. Tell me more about Fresno Surgical Hospital. Why do you love working here?
Fresno Surgical Hospital is an outstanding facility. They have the latest technology. They have a dedicated staff. And they really make it a very pleasant experience for both the patient and the surgeon.
And, tell me again, you are a joint replacement surgeon. How long have you been doing this for?
I've been in practice for 4 years.
And you're a young guy, but hey, I think you know what you're doing.
I think so, yeah.
Well, you seem great. Thank you again. We've been at Fresno Surgical Hospital with Dr. Dalal. He is a joint replacement surgeon here, and he works on hips and knees. And if you want any more information, make sure to check out the website. Give Fresno Surgical Hospital a call. You're watching Lifestyle Matters. I'm Marilyn Moore, and we'll see you next time.